Welcome to the 2025 Focus on Eye Health Summit. Thank you for joining us today from locations across the U.S. and more than 50 countries across the globe. I'm Jeff Todd, President and CEO at Prevent Blindness. For those of you who may need a description, I'm a white male, thin brown hair. I'm wearing a light blue shirt with a blue background with the Prevent Blindness logo. The same background will be behind most of our speakers today. We're excited to bring you expert presentations, valuable resources, and the chance to connect with others committed to advancing vision health. Since 1908, Prevent Blindness has been dedicated to preventing blindness and preserving sight. Our mission is anchored in three strategic pillars: educate, advocate, and collaborate. Through education, we empower communities with vital information on eye health and safety. Through advocacy, we champion equitable access to quality eye care. And through collaboration, we unite with partners to expand our impact nationwide. Our work alongside our state affiliates extends far and wide. 2.5 million annual page views on our website. Over 2.2 million children and adults impacted through direct eye health services. 45,000 plus email subscribers. More than 750,000 individuals reached through public eye health and safety education. 13,000 plus engaged through professional education and training. Statewide connections through technical training and community services in all 50 states and beyond. And tens of thousands of people engaged through our social media across many platforms. We thank all of those who join us in championing vision and eye health. Because of you, Prevent Blindness continues to be a trusted leader in ensuring vision health for millions of people in the U.S. and beyond. Before diving into today's event, I'd like to share two important announcements. Just over a month ago, Congressman Mark Vesey, a Democrat from Texas, and Congressman Gus Bilirakis, a Republican from Florida, reintroduced the Early Detection of Vision Impairment for Children Act in Congress. This is known as the AEVR Act. This bipartisan legislation is focused on improving children's vision and eye health by enhancing systems of care and promoting best practices. To learn more, I encourage you to visit the AEVR booth in the exhibit hall or the Prevent Blindness website. Next, I'm thrilled to announce the recipients of the Prevent Blindness Ginny Pomeroy Award for Excellence in Vision and Public Health and our Rising Visionary Award. The Ginny Pomeroy Award is named after a dynamic woman who led our affiliate Prevent Blindness Georgia with remarkable vision and passion from 1996 until 2013. This award honors individuals, teams, or organizations that have made a significant impact to public health in vision and eye health. This year's recipient of the Ginny Pomeroy Award is the Dean McGee Eye Institute for its groundbreaking contributions to vision and public health research. Since its founding in 1972, the Institute has been committed to serving Oklahomans and the global community through patient care, education, and research. I'm also excited to announce that Dr. Patrice Hicks from the University of Michigan is the recipient of the Rising Visionary Award for 2025. This award recognizes emerging leaders in vision and eye health, and we're proud to celebrate her as a rising star in the field of eye care. Both awardees will be formally recognized during two Focus on Eye Health webinars this fall, which will continue the dialogue we began today. More details will be shared with you on those in the coming months. For 14 years, this summit has brought together diverse voices to explore vision from a public health perspective. This year's theme, Perspectives in Vision, highlights the importance of a collaborative, multidisciplinary approach to solving eye health challenges. Today, you'll hear from professionals, policymakers, patient advocates, and innovators who are driving change in vision care. We hope the dynamic keynotes, panels, and interactive chats inspire actionable solutions for better vision health worldwide. Now I'd like to extend our deepest gratitude to our sponsors. Their support makes this event possible. Our platinum sponsors include the Alliance for Aging Research and Pharma. Our gold sponsors are Amgen and Bio, Bright Focus Foundation, the Collaborative Community on Ophthalmic Innovation, and Genentech. And thanks to our silver sponsors whose generous support is vital to our mission. To kick off our summit today, our keynote panelists are Elisabeth Fowler and Jennifer Jones. Elisabeth Fowler is the CEO of the Canadian Ophthalmological Society, and Jennifer Jones is the president and CEO of Fighting Blindness Canada. This morning, we'll discuss how the U.S. and other countries can take lessons learned from the recent passage of Canadian National Strategy for Eye Care Act. Welcome, Elisabeth and Jennifer. So, Elisabeth, could you share a bit of background information about the Canada National Strategy for Eye Care?
Hello, everyone. Thank you. I sure can. My name is Liz, and I am a white woman in her mid-50s. I've got kind of blondish shoulder-length hair, and I'm wearing pink glasses and a pink blazer. So before I jump into Bill C-284, I thought I would just give a little bit of the Canadian context, and I'll try to fill in some gaps as we go along as well. So over 8 million Canadians are living with an eye disease, so that's about 1 in 5. And there are 1.2 million Canadians living with vision loss and blindness. And so not only is this a profound impact on everyone when living with vision loss, but it also costs the Canadian economy about $32 billion every year. And despite this, we've never had a national vision health strategy until now. And that's due to a dedicated member of parliament and I would like to thank a group of advocates who came together to help make this happen. So as a spoiler alert, what Jennifer and I will be talking about, it's not a story of conflict or tension, but really quite a beautiful story of collaboration and cooperation and hopefully an example of what we can do if we put aside our personal and issues and work together. So on to the bill now. In November of 2024, the Government of Canada passed Bill C-284, the National Strategy for Eye Care Act. And what this does is it sets legislation that puts forth a comprehensive framework to develop a national strategy. So some of the goals of the strategy are to identify the needs of healthcare professionals and other professionals in relation to training and guidance on the prevention and treatment of eye disease and on vision rehabilitation. It promotes research and tries to improve data collection. It promotes information and knowledge sharing between the federal and the provincial governments, and I'll talk a little bit about that later. And it also tries to ensure that drugs and devices will be more readily available. Once the bill was passed, Health Canada, which is a federal government department, was tasked with doing consultations and creating a report that they must deliver to the Minister of Health within 18 months that outlines their strategy. At the time of the passage of the bill, the Liberal government was in power. So the Liberals most align with the US Democrats, but we do have several parties. So in official opposition were the Conservatives, who align more with the Republicans, but we also have the New Democratic Party, the Green Party, and the Bloc Québécois. They don't agree on a lot all the time, but in this case, they did all unanimously pass this bill, which is a rare and really powerful event. Since that time, we recently had an election and the Liberals are back in power again. I mentioned that there are sort of national and provincial governments. So the national government, the federal government deals with things that are of national and international nature. So defense, immigration, currency, economy, that kind of thing. And then there are 10 provinces and 3 territories, and they each have their own governments, which administer their population. So things like healthcare, education, property rights, that kind of thing. So in effect, Canada has 13 different healthcare systems, essentially.
Well, I think it's heartening for a lot of us to hear that there was bipartisan or multi-partisan, in your case, support. I think that's certainly necessary for any advancement in eye health policy. So what was the catalyst for the bill?
So Canada's never had a national strategy, despite frequent calls from various advocates. And we have signed on to various WHO and UN resolutions on vision health, but as a country, they haven't been very effective in doing anything to kind of further these goals. And the Canadian healthcare system, while a beautiful and wonderful thing, is also creates some gaps. So the National Healthcare Act was created in the 1960s. And so, for example, if you have a retinal tear, if you have an accident, you would see an ophthalmologist. Because they're a physician, they're covered under the Canada Health Act. And as a result, you don't have to pay anything for your surgery or your care. However, if, like me, you need glasses and you're between the ages of 18 and 65, and you need to see an optometrist because they're not a physician, you are not covered under the Canada Health Act. So it leaves some gaps in care, and this did not sit well with MP Judy Scrow. So every member of parliament is allowed to set forth their own private member's bill. And because she had some personal and familial experience with vision loss, and because she didn't like the fact that treatment is separated across the provinces, and that eye care shouldn't be treated as a luxury, she put forth her private member's bill that was specific to this strategy and national framework.
So how did the vision partners work together before the bill?
So before the bill, we all knew each other, we joined each other's summits. We worked together on reports if we could. We occasionally worked on press releases and stuff together, but there was nothing really coalescing. And we forwarded the needs of our own members and constituents, and had a lot of informal engagement, but really didn't work together. And so just to give you an idea, the Canadian Ophthalmological Society, the Canadian Society of Optometrists, the Opticians, Fighting Blindness Canada with Jennifer, the Canadian National Institute for the Blind, Canadian Counsel of the Blind, and a couple of others all sort of came together after this. So we started to work more closely together when we realized that this was a unique opportunity in time. And I'll pass it to Jennifer to talk a little bit more about that from here.
Yeah, well, it's really heartening also to hear about how, the power of coalition and what that means for your work. Certainly that EDV bill I mentioned earlier has a very strong collaboration support. We have more than 100 organizations supporting that, and I think that's the way that we advance these sorts of things. Jennifer, how did you all work together? What strategies did you employ?
Thanks, Jeff. First, let me take a moment to say hello and introduce myself with my description. I'm also a white woman in my mid-50s with blonde hair. I'm wearing a white blouse, and probably no surprise to this audience, I am using reading glasses. To get to your question, I think what your audience is going to hear is a lot of what would fall under the category of best practices. So there isn't a lot of shock and awe in any of the work that we did. Instead, I think it's a real reinforcement of, key steps that you should be taking and taking with real seriousness as you move forward. Because of course, if you make a misstep at one point, it could derail the hard work that's already happened. In our case, we had real process discipline. We had standing meetings that kept us connected along the way, and people really honored that. We had agendas that we came forward with in order to make sure we're using that time effectively. We really stayed united along the way, like what Liz said, so that we had a shared voice, which gave us more influence when we came to Parliament Hill, for example, or we were talking with any of the MPs. We leveraged our expertise as best as possible. We each came with different areas of expertise, but when we needed to, we combined budgets and went outside and hired external expertise. In our case, that was a GR firm that we used to coordinate an effort that we had on Parliament Hill, where we all came together in Ottawa, which is our capital, to meet with MPs who would give us some time on this conversation, as well as some senators. At that point, it was the Senate that was the last step for us to get through. And so we wanted to make sure that we were bringing some gravitas to those conversations by being really linked, like arms were linked. We made sure that people with lived experience were at the front of the conversation. What we heard from a Senate interview we did, where we brought an individual who was with lived experience, who was really articulate, that person probably got more airtime than any of the national organizations. So never forget how important it is to bring those people into the conversation. And after all, that is the reason that we're doing the work we do. Lastly, any communications that we did was shared. So we would have drafts that made sure that all our voices were being represented. And then we would often go out with a united piece, and then we would tailor those pieces and take it to our own stakeholders. So we were again in lockstep the whole way.
Great. So Jennifer, what do you think were the key factors for success in ultimately getting this act passed?
Yeah, it's kind of a continuation of what I just said, where we had really strong project management process. We had deadlines. We assigned action items, so everyone took real responsibility. Probably the thing that I was most impressed by was the lack of ego at the table. While yes, every organization had nuances that they had to honor, especially back to our board of directors and our stakeholders, we really make sure that not one organization was overshadowing anything else. And so while at different times, different organizations took the lead because of any expertise they had or resources that were available, in general, we made sure that we were all moving forward in the same time with the same pace and the same respect for our mutual goals. And then, momentum is a thing, and momentum can create a sense of urgency and a sense of needing to make things happen in real time. I think we kept the momentum going, and that created an inertia that gave us just, let's keep going and let's not get stuck. And so I would also say, really respect momentum and make sure that it doesn't get interrupted if it doesn't have to be.
Yeah, and obviously a lot of work, but I think also these things, making sure that it's coming at the right time is really important, and the timing. So, I mean, were there any key issues that Parliament was dealing with, or the administration, that created that right time, right environment?
Right, because you're absolutely right, because no matter how much we might have been working in cohesion, if the environment we weren't operating in wasn't supporting us and it was just creating obstacles, we might have struggled a lot more than we had. So it sounds like a bit of a fairy tale, but maybe, certain colors would have been seen if we had started running into blockades. We didn't we had hurdles we had to overcome for sure. It didn't go as smoothly as it sounds, but I would say there were a couple things in the ecosystem that made this work in our favor. And yet it still took a couple of years, right? So this wasn't like a 6-month overnight success. This was several years in the making. The first thing is that we had our Minister of Parliament, Judy Scrow, taking the lead on this. Without her commitment and her leadership, I'm not sure this would have gotten off the ground. And it probably would not have got across the line. So having her represent us in Parliament along the way and have the connections to bring the right people together at the right time was critical. We also had no funding attached to this. So I wouldn't say it was easy getting it approved with a bipartisan or nonpartisan approach. But let's face it, we weren't going in saying this is going to cost X millions of dollars. And so I think it kept everyone at the table longer and got us across the finish line. We also recently in Canada had a dental bill passed and a new national pharmacare bill too. So there was a bit of a conversation already happening around making sure Canadians were getting the right access and starting to get equitable access to important health care. When this is also perhaps important, the National Eye Care Strategy was improved just last November. However, we were hoping it would be approved last June before government went into the summer break. And so we did a real concerted effort to get in front of the MPs and the senators before the summer and hoping it would put some pressure on them. We also had a government that was starting to weaken. And so we were concerned that if we didn't really strike while the iron was hot, we might lose momentum. and government could switch, and we could have to kind of start again. So that real push before summer break last summer might have actually really helped us. Who knows? But I think for us, it was an important moment of us showing up together very publicly on and again singing from the same song sheet. Now, in the end, they broke over the summer, and we had to wait until fall. But perhaps that rallying together last June really made a difference for us. And so I think there's a lot of moving pieces. This goes back to us leveraging some GR support that our organizations had, and then those we also hired to make sure we were understanding all the levers that we could pull and the right time to pull them.
Got it. So, wow, it just sounds like your coalition did all the right things at all the right time. I'm wondering, Liz, is there anything you might have done differently looking back?
Well, no one's perfect. No process is perfect. And I mean, ultimately, it was successful. So we're pretty pleased about that. But thinking back, we didn't create a set of sort of terms of reference or some guiding steps of how we would work together as a group until more recently. And I think in retrospect, that might have been helpful because there were a couple of times, and this continues, we're all human and we communicate in different ways. So there were the occasional miscommunication or misunderstanding within groups. So I think over communicating, like, telling the whole, tell them what you're going to tell them and then tell them again. I think we probably could have done that internally as well, just to make sure that no one was surprised at any point in time.
Yeah, a lot goes on in the background, right? Liz, what's happened since the bill was passed?
Well, the first thing we did was we held a reception to celebrate, and we sent out a press release, which basically said, "Yay, it's been passed," and onwards and upwards. And then we took a deep breath and met again. Our group met to say, okay, we've got a lot of momentum. We've had this success. How do we make sure it continues? There's this 18-month window where Health Canada will be pursuing their consultation. So what can we do to be as supportive and impactful as possible? So the group decided to create some terms of reference, which we have done. And we set regular meetings. So we meet every 2 weeks. And then we met with Health Canada, and because Jennifer mentioned the government was weakening, I mentioned there was an election, they've had to pause their work. And there was some concern that what Health Canada would be able to put in their report might be a little bit watered down because they are constrained by the fact that they are a government agency. And so we felt it would be important to work together to create our own, do our own consultations and create our own document that would truly reflect the needs without any, constraints of what we thought a national vision health strategy should look like. So we pooled our money again, and we've hired a firm, and the consultations are beginning. We're going to be doing one-on-one interviews, an online survey. We'll be doing some focus groups to gather information and figure out what needs to be in the report. And then we'll have a meeting at the end of the summer with hopefully to have our finalized report early in the fall. We've talked to Health Canada about the fact that we're planning to do our own consultation, and they were very supportive and asked us to share the report. So I think we'll consider it a very big win if Health Canada is able to pull pieces of our report and include it into theirs. And once we have that report, then we'll start reaching out again and continuing our advocacy with the various members of parliament and bureaucrats, et cetera.
Got it. So Jennifer, obviously there are a lot of things going on here in the US these days, and some of that is impacting the relationship between the US and Canada. How are the changing times and events in the US impacting the Canadian vision health sector and your relationship with the US?
Yeah. So you can imagine that all of Canada is paying close attention to the changes in the US. And, there's that old saying, may you live in interesting times. And whew, these are interesting times. And, what we're seeing in Canada, and anyone that is tuning in right now from the US around the world may be facing similar an evolution of how you operate. We are moving to a little bit more of a Canadian, like buy in Canada. The tariffs are a real concern for us. And so we're trying to make sure that we're supporting Canadian products. And I think that's just a pragmatic approach that we're taking. The tariffs have also contributed to increasing costs on a lot of essential services, which impact, broadly general Canadians, but also, of course, the vision sector, in particular, the small and medium-sized businesses who operate, like the optometrists Liz mentioned earlier. Over-the-counter medications and medical devices which largely come out of the States, will have tariffs, and that'll be punitive for our business operators, but also our Canadian consumers who need access to that kind of care. And then as a research organization, because Fighting Blindness Canada is the only and the largest charitable funder of vision research in Canada, we're really paying attention to the funding reduction that's happening in the States, particularly with the NIH. As you all know, the US is such an important investor in biomedical research, and the outcomes that are generated in the States benefit the entire world for generations to come. And so we're very much keeping our eye on what does that mean for the Canadian vision ecosystem? And is there anything that Canada could do to step into the gap that this is going to create? We do not have the same level of funding at all relative to the States, but we are still wanting to make sure that we play as much of a role as possible to support vision researchers, and also can we complement anything that's happening in the States? We know that there are some charities, even outside of vision research, that are talking to their US counterparts to say, like, is there something we can do here to support you, to keep projects going, etc. So rather than have this disrupt relationships at the community level, I think it's actually strengthening them in many, many ways. I know we're reaching out to our research relationships in the States and around the world to make sure that we all continue to have an open line of communication. And I mean, that's why Liz and I are here today too, right? Like, these relationships should weather this storm, and it's important to us that they do.
Yeah, absolutely. And I certainly agree. I mean, in addition to tariffs, I think one of the biggest impacts we're going to feel is the research impact that's going on. But it's great to continue these relationships that we have across borders. So how is the Canadian leadership, the new Canadian leadership, very new, anticipated to respond to the bill, and how will this inform the work that you're all doing?
Yeah, we're in a holding pattern right now. I mean, they only took their seat less than a month ago, like just 2 weeks ago. And so us, as well as us being my organization, I think the vision sector, but all the charities and businesses right now are kind of waiting to see what's going to happen. But in the meantime, we're also sending out communications to the new leaders in our regions, provincially and federally, to welcome them into their position, make sure that we reiterate our commitment to vision health, and that the national eye care strategy is continuing to go forward. So it hasn't stopped any of the work we're doing, but it has paused maybe the timing of what we're going to do to make sure that we're talking to the right people at the right time. And then it's also saying, like, are there new opportunities that are coming out of this? Is there someone who's now in a position that wasn't 6 weeks ago that we know could be an advocate for what we're doing? So it's just continuing to do the work we've always done. I would also say that our new Prime Minister, Mark Carney, is a pretty well-renowned world economist. And so we're really going to lean into the economic impact of vision loss in Canada, which for us is about $33 billion a year. So using numbers, I think, will hopefully grab attention in a net new way.
Yeah, that's great. Well, before we turn and invite the reaction panel into this discussion, one last question for both of you. In a few sentences, what guidance would you give the U.S. or other countries who would like to do similar work?
You got to honor and be humble that we in many ways, I think, kind of got lucky. Like, I think you have to really respect the work that we put into it, but also acknowledge there are a lot of factors that went in our favor. So I say, what I'm going to say is I say with honor the ecosystem that every country is operating in right now. But first, find your people. Find people who have a common vision for a common audience. In our case, we always put people living with vision loss and those family members who are impacted by that in our bullseye. Put aside your differences. This is not a time for egos. This is about a time for getting across the finish line together. Understand, again, the socio-political economic conditions that you're working in, and as best you can, understand if they're going to work with you or against you, because timing may require you to think about postponing or accelerating. If you have a champion within the government, leverage that as much as you can, make them a strong partner, leverage the expertise you have, and when you don't have it, find it somewhere else. Commit to working principles. This is very much what Liz was talking about, what we probably could have done better at the beginning and what we're now doing as we actually develop the eye care strategy is have that charter of how you're going to work together. What are the values you're going to bring together? You know, what are the accountabilities, responsibilities, etc., to make sure that you're starting off with your best foot forward. Be very clear on what your outcomes are. And then, of course, also celebrate the small wins and the big wins, because, you know, this is a team effort and teams need to be celebrated as much as they need to be held accountable.
Great. I think those celebrations are even more important when you're talking about a big coalition like that.
Yeah.
What about you, Liz?
So I agree 100% with everything Jennifer said. And also, you know, everyone in a coalition will come with their own personal needs of their members. But what really was helpful for us was deciding on and agreeing to sort of a key set of things that were important to us. And if you can put that down in paper in a, you know, nice infographics and very easy to understand so that the main message can be readily absorbed, you can use that as a handout. And so that means that even though when you meet with someone, you can talk about your own things, you say, but here's what we're doing as a group all together. And the more times people see that one thing, the more times that message is reinforced and they can pull the key things that you're talking about. As Jennifer mentioned, having the voice of people with lived experience and expertise front and center, so important. And nothing really replaces that. I would also say use any means of communication that you have available to you. So anytime you can get in front of someone, whether it's going to a reception that may not be about vision health, but about something else, and you know some of your key champions will be there, use that. Write letters, set up one-on-one meetings, do phone calls, like whatever you can do, just keep getting in front of them. And again, the more times they hear the same message, the more they will listen, hopefully, and recognize how important it is. And then I would say, don't give up. You know, it can, as Jennifer mentioned, it was 2 years, and there are times and you're like, another reading in Parliament, oh my God. But just keep going and keep supporting each other, and hopefully you'll be successful.
Thank you. I really appreciate that. I appreciate both of you sharing so much. As I think we talked about in one of the kind of pre-discussions getting ready for this, it's easy to say, let's pick up what's done in Canada and bring it here, bring it there, whatever. And that's simply not the case. No country is like another, but there's so many great learnings that we can pick up from what you've achieved. And so now I'd like to invite a couple of my US colleagues in as a reaction panel to further this discussion. I would like to introduce now Philip Goglas. He's the managing partner at the Health and Medicine Council. And Dan Ignaszewski is the executive director at the Alliance for Eye and Vision Research and the National Alliance for Eye and Vision Research. They'll share their points of view around how we can learn from Canada's efforts as the US and other countries look to make a national governmental priority around vision. Welcome, Phil and Dan. Phil, I'm going to ask you the first question. What can we in the U.S., along with other countries around the world, learn from Canada's efforts as we look to make vision a national governmental priority?
Thanks, Jeff. Happy to be here. I'm Phil Goglas, as Jeff mentioned. Work here in Washington, D.C. I'm a Puerto Rican male with a blue shirt, a red tie, and a blue Prevent Blindness background with black hair. What I think is most important from what Jennifer and Liz were talking about, and I think, Jeff, you hit upon it, is there are a lot of differences between how Canada operates politically versus the US and other countries. But I think what's most important is hearing everything that Jennifer and Liz did in Canada, how it worked in their system. But there are some things that, can be done anywhere. And I really want to highlight the small wins, celebrating those, the big wins. So for us here in the US, we have the AEVR Act that's been reintroduced. So the small win on that was getting it introduced the first time in the last Congress and gaining co-sponsors. Small win was it getting reintroduced in this Congress, given the current political climate that we are in. And then focusing on continued engagement with elected officials. It's no secret that it's a very interesting time here in Washington. And for those of you who may not have been keeping up, there are a few committees that have gone through the night and were in a markup reviewing bills for about 36 hours over the past day or so. So there's just a lot happening here in Washington. But what's important is having that personal connection, writing those letters, having that one-on-one time, engaging with your elected officials, because you'll see oftentimes that, yes, they may try to have their own specific legislative agenda, but when they get feedback from their constituents, that's what helps guide them and what they're ultimately going to support. We saw that years ago with conversations around the Affordable Care Act, where folks came out very strongly against those proposed changes, and members of Congress listened to their constituents and responded to that. But also, as we focus on AEVR, we have those supporters in Gus Bilirakis and Mark Vesey because of our working relationship with them, because of folks connecting with them. And we continue to gain support for our piece of legislation and all of our priorities because of that continued effort. So understanding the political environment is also critically important. And Jennifer, thank you for raising that, because I think it helps us be realistic as well when we're looking at how are we engaging with folks. For example, our champions on this bill both serve on the Energy and Commerce Committee, and they've been in a markup for the past, I think day and a half at this point. So we know now's not the best time to reach out to them because their staff is definitely fried in terms of those types of engagements. But figuring out how do we leverage the congressional calendar to our benefit? How do we ensure that when they're here in session, they're hearing from us? When they're back home in their districts, that local advocates are connecting with them. We do have our traditional August recess that all members are back home in their districts. So that's a prime opportunity for folks to engage. And I really cannot stress enough how important it is. And, Jeff can attest to this because he's been on the Hill in meetings, how important it is to have that personal touch and that ask from a constituent to say, Congressman Jones, I live in your district, Senator Smith, I'm in your state. This is something that's critically important for me. Please be supportive of it because here's why it matters. So I think that is critically important, no matter what country you're in, is having that engagement and making sure that you are connecting with decision makers, you are educating them about what priorities are critically important, how they should be supportive, because there's the old adage here in Washington, if you're not at the table, you're on the menu. So just making sure that you're consistently engaged with folks really does make a difference.
Thanks, Bill. And fun fact, I was just reminded, you mentioned AEVR earlier. It was introduced first a year ago today. So nice day for us to have this as a little celebration. So
and
Dan,
Jeff, if I could piggyback off of that, I think that's a win to celebrate in and of itself. So last year, it was introduced in May in the second session of a Congress with a few months left to go in that Congress. This year, we introduced it well before, early on in the first session. So now we have a longer time in this current Congress to gain supporters for the AEVR Act. So I think, we're talking about celebrating small wins. I think that's an important win to celebrate, where our timeline has improved and we have even more time to engage with folks. And we're already seeing how that work is being beneficial.
Yeah, absolutely. And I'll repeat this throughout the day, but we're only going to pass this bill if we get all the support we need. So anyone watching, go to the Prevent Blindness website. You can find everything you need to support this bill and its passage. So Dan, I'm going to turn to you and same question. What can we learn from our friends from the North?
Yeah, no, I really appreciate the opportunity and appreciate the opportunity to share with you all. I'm Dan Ignaszewski, and I'm a white male, 40 years old, brown hair, beard, and blue and white checked shirt with a Prevent Blindness logoed background. And no, I think that there's a lot of things to learn. I think that Phil, I think, really touched on the importance of bringing people together, and Jennifer and Liz, I think, really highlighted the value in bringing disparate groups together that may not traditionally work together or traditionally be engaged together. I think that what we've identified in terms of being successful in any advocacy effort is really coming together as a different as those different groups, and really unifying behind a strong message. I think that EDV Act is a great example of what Prevent Blindness is doing in that space already, bringing a lot of folks involved, and getting a lot of organizations involved, getting their members involved, and really getting the community involved. I think that beyond that, I think, we as organizations really need to come together and support some of those initiatives and kind of drive some of those efforts. I think that's one of the things that as an organization, we really have that obligation to follow some of the examples of what they did in Canada, and what the groups did to be able to identify these strategies and craft their priorities to be able to prioritize this with the government. I think that's something that we can share. One of the things that when I came to the vision space a few years ago, I was surprised by, although maybe I shouldn't have been too surprised, was that there wasn't really this coordinated strategy across government agencies for blindness or for low vision. And I think that that's something that, low-hanging fruit, that's something we could talk about. There's not necessarily money involved in developing a workforce or a task force that engages different federal agencies to try to support some of these efforts. I think, again, the EDV Act is a great example of raising awareness about some of the issues in the community and how we can try to affect change. And I think that really developing that community strategy, getting sort of the messaging involved around the initiative, and trying to get that prioritization across the different groups in the United States to prioritize this and really engage on it, and then really engaging the patient population to help champion those efforts. Phil really highlighted that, and I think Jennifer and Liz did as well. We need the patient voice, we need the community voice, we need caregivers, providers, researchers. We need kind of everybody to come together on these issues and really follow the lead, and really elevate why vision should be a national priority, how we can affect change, and what goes into that from both a research perspective, a care perspective, an access perspective. All of those things I think are vitally important, and we can't be successful without engaging the community at a high level.
So thank you for that, Dan. How can we overcome the obvious political differences we have in the U.S.? I know we heard how the Canadian effort was supported from a nonpartisan position, and I know that's much more complicated than it sounds. But certainly there, as we know, there are challenges here in the U.S. right now, politically. How can we overcome those without getting caught up in all the politics?
I would say having that personal connection is what's critical, because everybody has eyes. Everybody wants to be able to see. This isn't an issue that is a political issue. This isn't an issue that only affects Democrats or only affects Republicans. This is something that is above the political fray. Now, granted, everything in the healthcare space nowadays is incredibly politically charged, but what we strive to do is localize it as much as possible. And that's why having constituent outreach is critically important, because yes, we are talking about programs, we are talking about congressional support through some appropriation, but at the end of the day, for EDV, we're talking about children, and we're talking about why it matters for the future generation. So by avoiding getting into the politics of everything, and we have supporters who are very conservative, we have supporters who are very liberal. So our concern and our focus is speaking about the issue and how it affects everybody, and really driving the importance home to say, who wants to have their children have eye issues that aren't addressed? Who wants to have any of these problems continue when we know how important it is for our children to be able to see? So I think driving those points home is incredibly important while avoiding what I would call the pitfalls of the politics and getting into sort of the personality of some other items, but really just focusing on what I call the specifics that are never partisan in any which way.
Got it. Dan, any thoughts from you
Yeah,
on that?
no, I totally agree with Phil, and I think that those personal connections are hugely important. We've talked with members of Congress who, some of them are aging into eye disease and different vision loss. Some of them have family members who are experiencing vision loss. Some of their staff have experienced or are experiencing or know someone who's experienced vision loss or vision impairment. And so using those connections, identifying some of those folks to sort of share that connection and help identify opportunities for collaboration and partnership is really valuable. I think besides that, again, Phil's right, vision is not a partisan issue, or it certainly shouldn't be, right? Everybody's got eyes, everybody wants to be able to see and be successful in terms of living the life that they want to live. And I think that one of the things that we've also realized is that, the messaging components of how you communicate with different offices, whether it's Democrat or Republican, broadly is the same in terms of the overall impact, but there's also some nuanced approaches that you can take. I think Jennifer and Liz talked a little bit about some of the statistics and data that they brought. That's really valuable. When you're talking to a Republican or a more conservative office, it tends to be valuable to highlight the fact that vision loss and vision impairment costs nearly $200 billion a year in the United States. We want to try to reduce those costs, reduce the impact of that, and improve people's lives. And so helping people understand the economic argument and the care argument piece from the conservative side. And from the more liberal side, I think there's a lot of the community living, independent living, additional support and things that way that you can identify with some of your messaging. And I think that tailoring your messages to those offices while remaining bipartisan and focusing on the fact that this is a bipartisan issue, I think is a really effective way to do that.
Yeah, I think your point about really touching on the personal is important. As we know, pretty much everyone, if you live long enough, is going to have a need for eye care. I mean, I think that's a given, and it's something that we can certainly tap into. Do either of you have any thoughts on the success in Canada and the different systems that we have in place, different health systems we have in place here in the US versus Canada, and how despite those differences, we can utilize a similar path forward?
While we do have different systems, I think that there's still a really valuable approach in terms of, identifying some of those same strategies. Again, bringing the different groups and organizations together around a shared message and shared prioritization of vision, making vision a national priority, really elevating that. I think that bringing the organizations together is really valuable. And engaging the community. I think, again, learning from Canada in that perspective, it's very similar here in the United States. If congressional offices are not hearing from you, they don't know that it's an issue. And so they need to hear from patients, they need to hear from providers, they need to hear from researchers, they need to hear from industry about why research or why vision is important and why, why we need to elevate these issues.
The political systems overarching may be different, but elected representatives still need to and are held accountable by people who elect them. So it doesn't matter if it's a parliamentary system or the system we have here in the States. Everybody who stands for election knows that they have to be responsive to the people who are voting for them, because that's how they win. If they're not responsive to their constituents, they're not going to be there for very long. So being able to, again, understand how Jennifer and Liz worked very closely on, and I know this may tie into some of another question we may have, but coalition building, critically important, engaging with those folks to really spread out. And I know Canada's big, US is big too. What we focus on is a nationwide grassroots advocacy push to do this. So that way we have folks in Massachusetts reaching out to their very liberal House members, but in Florida, we have those same advocates reaching out to very conservative members who are representing districts in Florida. hearing the same message, and that also keeps it above the politics as well when you have a consistent message that's being shared across the country in different offices with different folks who have different ideologies, and that's perfectly fine, but really engaging with them and saying, how does this benefit, Los Angeles at the same time it benefits Jacksonville, and it's benefiting Houston at the same time it's benefiting Boise, Idaho, which are very different areas in the country. So I think really having that guidance from how Jennifer and Liz were successful is going to be important.
Thanks. I think one of the things that I've been reflecting on a lot is as we're looking at changes in the U.S. healthcare system or structure, while there are a lot of challenges there, I think the silver lining, at least from an eye health perspective, is we've not done a great job of eye health in the U.S. And so this might give us an opportunity to be part of rebuilding something different that is more impactful for eye health. That's the optimist in me there. But Phil, you spoke a bit about coalitions. Can you dive a little more into that, about how we in the U.S. or other countries can continue to build on the coalition that we've started, whether it's around this EDV bill or something else?
Yeah, so coalition building is critically important. Prevent Blindness is perfectly willing and capable to lead the charge on the Hill for this bill, but it's even better when you have other organizations that are supportive. And we're very fortunate to be a very strong coalition builder in terms of bringing different stakeholders to the table, having them support EDV. And then this way, we're just multiplying our outreach and our ability to engage with offices. When you're also engaging with the Hill, it's great to have different communities support something very similar. A rising tide sort of raises all boats. So when you have multiple organizations going in on their Hill days or their different advocacy engagements and talking about how critically important EDV is, it really does make that shift for members too, to say, wow, you're the third or fourth organization that has come to me talking about how important this piece of legislation is. I really need to be supportive of this. So really working in coalition is helpful, but I think what we can definitely learn from Canada that's always important is making sure you're checking your egos at the door, because at the end of the day, we all want the same thing. We all want this important legislation to pass. So how do we do that? Working together. It's not about one organization. It's about all of us being engaged together and working to ensure that we are doing all that we can to see this important policy implemented.
Yeah. And Dan, I know your really important work to advocate for funding for the National Eye Institute and the National Institutes of Health really can't be done without coalition. In fact, the alliances are a coalition, and Prevent Blindness is proud to be a member. Can you talk a little bit more about the importance of coalition in your work?
Yeah, no, absolutely. We are an alliance, an organization that is supported by members like Prevent Blindness, and we thank you for your leadership and support. But I think that it's a chance to bring people together from varying backgrounds. So we're a coalition of patient groups, provider groups, foundations, research funding foundation groups, different associations and networks that support vision and vision research. And also industry. And I think that it's important that we connect all of those partners in any advocacy efforts that we do. I think, again, that shared messaging and shared voice is what's really valuable when it comes to coalitions and the success that Canada has seen. We're always interested in expanding beyond our existing networks. And I think that that's something we always need to look to is when you're looking at coalitions, how can you identify other folks that are in the space that may not have historically been involved. I'd love to sort of strategize on how we can do more of that together. But I think that there's a lot of opportunity to be able to engage people. And again, the value of coalitions is vital because of that shared messaging, elevating that sort of unified voice to get people involved and understand the importance of what you're advocating for, whether it's research or the EDV Act or additional care or support.